Good afternoon. Welcome to our third presentation of the CCS Known Lecture Series. I'll begin with a few announcements. First, on Saturday, February 16th, CCS Chinese documentary film series will present Ai Weiwei, Never Sorry. The film will be shown at 7:10 p.m. in Auditorium A of Angel Hall. The series is free and open to the public. The next CCS Known Lecture Series will be given by Victor Ni, Professor of Sociology at Cornell University. He will be speaking on capitalism from below. Where do economic institutions come from? And finally, I would like to appreciate it if you could turn off your cell phones before the talk begins. Today's presentation will be given by Jersey Liang, Professor of Health Management and Policy at the School of Public Health and Research Professor at the Institute of Gerontology at the University of Michigan. His research has centered on comparative studies of aging and health across US, Japan, China, and Taiwan. Currently, he's exploring how psychosocial factors in conjunction with biomarkers affect the health outcomes at the individual and community levels, and how these processes vary across cultures. Today he will be speaking on physical performance and socioeconomic status among older Chinese, a multi-level analysis. Please join me to welcome him.
Thank you very much, Professor Duanmo, and it's my pleasure to have an opportunity to share with you some of my current research with you. And before I start, I'd like to introduce you to two of my collaborators, just came from Shanghai, China, Dr. Zhen and Dr. Guo. So they will help me if I get anything wrong. They'll help me to fix it. So if, on the other hand, if there's anything goes wrong, I'm not the only one who is responsible, right? So that's basically what I have in mind. And so let me just find my pointer. Okay, today what I'd like to, let me see, I want to make sure I can handle this well. Okay, here, before I start, I'd like to kind of just acknowledge my collaborator. My talk is based upon a collaborative research with my colleagues at the University of Michigan School of Public Health, as well as with my colleagues at the Shanghai Center for Disease Control and Prevention. And let me kind of give you some idea what I have in mind. Basically, today, I think in order to provide a context for my talk, I'd like to kind of give you some, share with you my views about what's going on in China and why it's important for us to look at health conditions, particularly as measured by physical performance among older Chinese, okay? So basically, I think many of you have heard about China, and I'm sure many of you been to China and have probably spent quite a bit of time there, maybe more than I have. I'd be very happy to compare notes with you. And also, but I think, you know, the most important things most of you probably have heard the economic growth or development in China. But I bet, probably fewer of you probably have heard what happened to the demographic transition and the epidemiological transition in China. So I'm hoping to kind of give you a very quick overview, start with economic development, and then try to link with demographic and epidemiological transition. With this in mind, then I'm going to move to what my colleagues and I are doing with regard to, try to understand health conditions among older Chinese. the big story, I'm sure many of you know that China actually has been growing quite fast. On average, roughly about 9 or 10% rate of growth of its GDP since the late 1970s, and this has been going on for 30 years. And this is quite unprecedented in human history. We know of no other society, okay? And it's actually quite parallel to what we call the Asian tigers, including Japan, Taiwan, South Korea. But, okay, China is growing so fast, and there is, okay, people been projecting China in about 20 years is very much likely to overtake United States as the largest economy in the entire world. And, okay, here, okay, what we have now is in the year 2009, China then was still ranked number 3, okay, in terms of its GDP, the gross national product. I mean, the gross domestic product is about 4.9 trillion, which is slightly below Japan. But guess what? In 2010, China overtook Japan to become the number 2 economy, okay? And, okay, we are projecting somewhere around before 2030, for sure, China is going to overtake United States to become the largest economy in the world. And even more amazing, by 2050, the Chinese economy would double itself. Okay, so there is, so many of you, probably not myself, will see the day the China's economy will be twice as large as the United States. So this is going to have very profound implications in terms of global economy and also in terms of global geopolitics. And I'll let you draw the conclusion yourself. And so China is, has now been characterized as the inevitable superpower during the next 20-some years. And some observer actually have projected by 2017, that's not that far away, the Chinese economy, if you adjust for the cost of living, the cost of everything, could already kind of be the same as that of the United States. So this is something which I think many of you have known, and probably not that of you have known what the future course of the Chinese economy. So I'm just trying to get you. That is the reason why it's so important for people, including Americans, to understand, okay, the world 10, 15, 20 years from now would be very different from the world which we have known. As a result of this rapid economic growth, clearly China actually has probably done more about poverty reduction than any other country in the world, okay? And you can see, okay, by the standard, the definition of poverty line as offered by the World Bank was like $1 per day. In China, in the year 1981, you have over 60% of the Chinese population below poverty. In the year about 2007, we have about 4-5%. So China actually has really, done more as part of its economic development, has, done in, reducing poverty. So that is a very good part of the Chinese, of the economic growth. On the other hand, okay, China has also, let me kind of go back, as a byproduct of the economic development is really income disparity. You can see, since the beginning of the economic reform in China. Then, okay, the differences here is urban to rural income ratio. In the late 1970s, okay, urban income on average was 2.5 times as large as rural income. There is a huge disparity. As economic reform started, in fact, okay, income disparity between urban and rural communities actually, declined quite substantially. But then it started to creep up. Okay. Another dimension is, okay, the coastal to inland GDP per capita ratio. That is basically in China, as many of you know, the most highly developed area is on the coastal area. The interior tend to be much underdeveloped, and you can see persistently, okay, the coastal areas average income was being higher than interior, but also this ratio has been increasing pretty rapidly. So as a result, we have what we call the Gini coefficient, which is a coefficient measures the degree of income inequality in China. The Gini coefficient has been increasing since the late 1980s. And now it stands roughly about 0.46. Gini coefficient, simply the way you interpret it, 0 means the income distribution is completely equal. 0 means the extreme, the maximum inequality. China is now, the income inequality is about 0.46. You can see China, in fact, the income disparity in China is even greater than that of the United States. United States actually has the most unequal income distribution among all high-income countries, as you know. And China has already caught up, and even more shockingly, many economists actually claim the degree of income disparity in China actually has been significantly underestimated, simply because the underreporting of income, particularly what they call illicit and gray income, which is not reported. So some people would claim the Gini index could be as high as 0.6, which is truly very high. And so that actually turned out to be a major concern, okay? So what is so special? Why should we be so concerned about income disparity? And many, experts would simply say income inequality would very much, most likely to lead to social disability, and actually oftentimes it could lead to revolution and political unrest. Economists have actually been talking about, okay, Stiglitz, who is an economist at Columbia University, also a winner of Nobel Prize in economics, made a strong case income inequality will lead to slow growth and less efficiency, okay? And also, we have epidemiologists who have been studying income inequality with regard to population health, and has made a pretty strong case that, high inequality in income would lead to poor population health, okay? And, okay, on the other hand, in a very interesting contrast, and Marty White, who used to be on the faculty here at the University of Michigan, now he's at Harvard University. He actually has collected survey information in China. And actually it's quite interesting the way he found out is Chinese people on average seems to be quite tolerant of this growing income inequality, even though most people will recognize it, but the proportion of individual express rage or anger towards such uneven distribution is actually relatively low. in comparison with similar numbers in other countries. In this regard, Chinese actually are very similar to Americans. Okay, they tend, they recognize the income inequality, but they actually can tolerate this quite well. There are two reasons Marty offered. The first one is Chinese economy is still growing very fast. So that means the standard of living for everyone is rising. The differences being people in the coastal area tend to actually, their standard of living, their income improved at such a fast rate. And so even, all the rest of China, they are growing at a slower rate. And nevertheless, everybody's standard of living is still improving, actually quite significantly. Okay, so in that regard, the other thing is, Chinese seems to believe hard work does pay off, even though there's significant degree of corruption and but they do identify with all these success stories. So in that regard, so we will still have to see how, the degree of inequality, but nevertheless, these top leaderships of the Chinese Communist Party has already taken this quite seriously. As recently, as a few days ago, they actually have, made offered a new proposal, try to do something about, try to constrain further income disparity. So you can see this issue is also pretty high on the policy agenda. Let me just go back. Okay, so that was the kind of economic development. In addition to economic development, I would like to kind of inform you, the economic growth is not the only thing which is happening in China. In China, also a very profound changes are taking place in China. That is related to its population. We all know China has a huge population, but we don't really know, not that many people realize the Chinese population is also undergoing very rapid urbanization. I remember when I went to China the first time in 1984, that was a long time ago, I think, about 20% of the Chinese population live in cities. Today, about 50%, over 50%. And just to give you the kind of scale of this, 60 cities with 1 million plus population. In the United States, we have only 9. In Europe, we have 36. 45 cities with 2 million plus, 24 cities with a population greater than that of Chicago. Can you imagine a country with 24 Chicagos? Imagine how many subway systems they would need, for example. And all this kind of really represents a huge market. That also, if anything, many people would say China still very much depend on trade, or with other countries or export. That is to an extent true, but on the other hand, I will contend China has such a huge domestic market. In a way, China can actually operate and survive and prosper essentially by producing for its domestic market. In some way, would be very similar to that of the United States. But the point is the Chinese economy in the future could be twice or 3 or 4 times as large as the U.S. economy. I think that is a message I'm trying to get across, so all of us still have to reflect upon what we have to do, because it is coming. And so, every time I teach, I speak to my students, I look at them, and I'm saying, how can I teach them in such a way they can confront a world which is so different from what I know? And the first thing is try to inform in this. And I'm just saying, okay, you think, I mean, that was the Chinese population in 2010. The projection provided by McKinsey Institute that by the year 2050, we could have as many as 120 cities in China with a total population greater than 1 million or more. It's just unimaginable, okay, what is going on. So I like to kind of, I'm not very good with this, so you're going to have to bear with me. I'll try it. You know what I will do? I will do this using brutal force. Great. How does the Chinese population come to this? I wanted to kind of, you know, give you an idea of the whole process of demographic transition, which actually all countries, you know, at one time or the other, you know, went through this. China is no exception, and as you can see, between 1950 and the year like about 2000, okay, this 50 years period, the Chinese population, first of all, in terms of its death rate, okay, declines very, very substantially. And the life expectancy around in 1950 in China was something like 35 or 40 years old at birth. Today, its life expectancy at birth is like about 74 years. So what you're saying is in a period of 50 years, life expectancy more than double, which is truly remarkable, okay? And at the same time, fertility, that is the birth rate, also start to decline. From all population, mortality will start to decline first, then birth rate would also start to decline. And however, okay, China, like all the other countries, birth rate is persistently higher than death rate. Therefore, you know, it led to very, very substantial growth of population. So with this in mind, okay, what I would like to show you, one of the probably the most profound consequence of such demographic transition would be, first of all, this is another way to describe the change in fertility in China. You can see in the year 1950, 1955, on average, each Chinese woman would have almost 6 children. That, okay, by the year around 1980, that has declined to about a little bit over 2 children. And that, you know, around 1978, the Chinese government instituted, many of you would know, as a one-child family policy. That means all married couples can only have 1 child. And that fertility rate start to decline by the year, okay, has declined to about below 2. Now it's roughly probably like a 1.8. In demography, when we look at the population growth and the relationship to fertility rate, you have on average, each woman should have at least 2.1 children in order for the population to maintain its current level. If the fertility rate should go below 2.1 for an extended period of time, you know what happens? Population start to decline. You may be surprised, but we are projecting the Chinese population would start to decline in 30, 40 years. Partially, it's because of the very, very substantial decline in its fertility. And using India as a contrast, you can see they start at roughly the same level, and the decline in fertility for India is much slower and much smoother. Major consequence of such substantial decline of fertility is population aging. So in 1950, people 65 and over accounted for only less than 5% of the total population. Today, about 2010, I would think it's roughly 8 or 9% of the total population. We are projecting by the year 2040, 2050, 22% of the total Chinese population will be 65 and over. You know what is the proportion of older people in the United States? Any idea? 13% right now. Okay? And so let me just show you another. Not very good with this. So just keep going back. Okay. Yeah, this is the one. So our projection is China. Okay? I mean, in I was saying about 8% of the Chinese population is 65 and over. By the year 2050, we're saying 22.6%. This translated into 334 million people, which is larger than the current U.S. population. Okay? At the same time, you compare, you wanted to know the magnitude. You look at the United States. In 1990, you know, U.S. population only 12.4% of being 65 and over, and you know, United States actually has been pretty stable. And then during the next 20 years, the baby boom generation is going to become retiring, so you would hit about 20.6. Even we extend it to about 2050, 21.7%. Guess what? By 2050, China is going to be older than the United States. Isn't that remarkable? At the same time, okay, I just wanted to mention all other countries are rapidly aging. Japan currently about 22, 23% of the Japanese population are 65 and over right now. You know what is the proportion of older people in Florida in the United States? You would think, you know, you want to see old people, you go to Florida, right? 18%. The entire Japan is older than Florida right now. And the Japanese population, we're projecting by 2050, 1/3 of the Japanese population would be 65 and over. And my colleagues in Japan are worrying about the closing of universities and colleges because they have such a low fertility. They have relatively few students. So that is just a reflection. It's a part of what population aging. And we are also projecting the Japanese population will be declining. Now the current Japanese population is about 125 million. We are actually projecting the Japanese population in 50 or 60 years could be reduced to under 100 million people. So needless to say, okay, population aging is, would, have a profound impact on the economy as well as the social institution. The other major consequences of population aging is also the epidemiology. That means population health would also change. In China now, 80% of the mortality is due to chronic diseases, 80%. And the top 3 causes of death, cancer, okay, cardiovascular disease, okay, and the COPD, the chronic, pulmonary lung diseases, okay, these are identical to all the other high-income countries. So in that regard, but on the other hand, we are actually projecting, this is the projections put out by the World Bank. During the next 20 years, we are projecting, the World Bank is projecting the chronic diseases in China could increase by 2 to 3-fold. So you're talking about myocardial infarction, heart attack. 2010 is about 8 million each year. 2020 would be doubling, 16 million. 2030, we're talking about 22 million, almost, okay? I mean, 3 times, 3-fold growth. You look at diabetes, 36 million, okay, 52 million, and 64 million. So you put them all together, okay, I mean, you have about 181 million by the year 2030. So these are the kind, okay, so what I'm trying to do is, okay, I started with the economic growth, then, you know, I try to relate it to population transition. Now I'm talking about population health epidemiology. So in reality, all these 3 processes actually, you know, are happening at the same time, go hand by hand. So we need to understand how they, you know, relate to themselves. So that's the reason why, okay, we are very interested in understanding, okay, the health conditions of older Chinese, or in a way middle-aged and old Chinese, okay, in relation to its socioeconomic status. So that's what I'm going to talk about, our research for the remaining of the talk. There's actually quite a bit of research done by epidemiologists and social scientists with regard to the linkages between socioeconomic status, oftentimes measured in terms of education, income, wealth, occupation. Okay, basically the conclusion is the evidence is pretty clear in the sense, okay, people with higher socioeconomic status tend to have better health. Okay, and okay, there is also another body of research actually showing, okay, not only socioeconomic status, you know, itself, but also the distribution of income would have another distinct impact on health. Okay, even so, this point is being rather controversial, and also, you know, really depending upon, and it's being hotly debated, you know, between people of different political camps, conservatives versus more liberal, progressive type. What we're trying to do is we're trying to be more empirical about it. We try to basically describe, okay, health conditions among older Chinese and with some middle-aged Chinese, and by using what we call physical performance measure. And the reason we wish to do that is because we clearly are not the first one who's been doing research related to health among older Chinese. We probably won't be the last one either. And what we are trying to do a little bit differently is prior research basically focusing on mortality, or when they talk about diseases, they oftentimes rely upon self-report. Okay, so we are actually trying to measure these, you know, people's, functional capacity by, you know, in terms of physical performance, and I'm going to explain to you what we did. And also, we're not only just looking at socioeconomic status at the individual level, but also at the household and the community level. Give you some idea how we compile the data. The data we have is actually quite an interesting data set, which is it's a massive study sponsored by the World Health Organization with funding from the United States Institute of Health. and including 6 nations: China, India, Russia, Mexico, Ghana, and South Africa. Okay, in China, basically, okay, they select 8 provinces or municipalities: Zhejiang, Hubei, Shanxi, Guangdong, Jilin, Shanghai, Shandong, and Yunnan. Okay, and as you can see, we actually they try to include province cities in the coastal areas. Then they also try to include in the kind of all somewhat, interior but more moderately developed country. Then they try to get, provinces in the west interior more underdeveloped. And they have, so within these 8 provinces, they select 1 urban and 1 rural sites, okay? And then within each site, then they would, do a bunch of multi-stage sampling, try to select individual household and then individual. All together, we have 13,000 respondents from 8,600 households located in 128 communities. How do we measure physical performance? We use what we call grip strength and the gaze speed. Grip strength, you have one of these. Just squeeze as hard as you can. 3 times, correct? And the grip strength and gaze speed are epidemiologically are very good measures because they tend to predict functional disability very well, okay? And when I talk about functional disability, one way is, for example, what we call activities of daily living, okay? For old people, in order for the clinician, for the social worker to decide whether an individual is suitable to become institutionalized at the nursing home, one quick way to tell is we check out whether the individual could use the bathroom by himself, feed himself, dress himself, ambulate by himself, okay? And I forgot the remaining, but anyway, out of the half a dozen of activities of daily living, if you cannot do 2 or more items, then you become a candidate for nursing home care. And so what grip strength and gaze speed actually could predict functional disability long before it happens. Also, it predicts your mortality, how long, your risk of dying. So so I think these are actually very useful measures for clinicians to assess an individual's health conditions. And also, in contrast with all the other health measures used by other investigators, these are more objective in the sense it tend to be more discriminating. It could discriminate, the different levels of health in a much more refined fashion, okay? And you can see, okay, here just give you an example of the breakdown of grip strengths by age and gender in our sample. And clearly male tend to have the stronger grip strengths, and clearly it's very consistently people in the older age group tend to have a, smaller strengths. We also try to measure socioeconomic status at the individual level. Basically, a prime indicator would be education. Okay, you can see, okay, in China, particularly for the current cohort of people who are 50 years of age and over, okay, the education, their education level of education is actually significantly lower than what we are, used to in Sorry, I did not. Sorry about this. Clearly you can see, I mean, educational level in general is significantly lower than what we're used to. Also, you have very significant gender differences. Women tend to be much less educated for this cohort. I still remember in the 1980s, late 1980s, when I went to China to survey. That time we did a survey of 3,000 elderly Chinese, 60 years of age and over. In the rural areas, I was astonished to find somewhere around 80 or 90% of women never went to school, were illiterate. This makes China so interesting is because the Chinese population is rapidly aging, yet in terms of its economic development, it's not like the other high-income country. So in China, they're very concerned about whether China is getting old before it gets rich. Because presumably, economically, you want to be sufficiently well developed in order to afford all the welfare state for old age support. But in China, okay, clearly they have this unprecedented challenge. In addition to the individual level of socioeconomic, we also measure the household. So we look at the household income, okay? We look at income and break it into quintiles. We also look at the consumption, I mean, how much money they spend per month. So that kind of give you some idea. What I will call your attention to is you can see very significant difference between the urban and rural, okay? In the rural, I mean, households, you can see, I mean, income is substantially lower, also in terms of the consumption. Then we move to what we call the community level, okay? We basically, I mean, we have about 128 communities. Then we try to obtain some measures on socioeconomic status. The most important one would be urban versus rural. For those of you who are not familiar with China, China is not one country. China is one nation with at least two states, urban and rural. Okay, China in effect has been practicing something very similar to the apartheid system in South Africa for a long time. It's still doing it. And this is going to be a huge challenge for China to overcome in the future, okay? So the bottom line is all the Chinese would have a resident registry, and your resident registry is inherent from your parent and is tied to the location of your current residence. So that, in a way, really substantially limits people's mobility. So in China nowadays, we have over 200 million migrant workers who have moved from rural area to the urban areas. But all these individuals, even though they've been living in an urban area, like say Shanghai, for 10, 15 years, they may still be without the resident registry in Shanghai. So what does that mean? That means they're not entitled to many of the social welfare benefits. The major thing is their children are not entitled to attend the public schools in Shanghai. Okay? So I keep teasing my Chinese colleagues. I mean, they're just like the illegal aliens in the United States. Okay? And except that they are all Chinese citizens. So in that regard. But anyway, this is probably the biggest. And as you recall, nowadays, I mean, urban income on average is at least 3 times as high as the rural average income, and is likely to be increasing. And also, we try to obtain the measures of proportion of respondents with primary school education or higher education, median household income, and consumption. So we basically have 3 levels. And, well, I feel obligated to show you some equations so you understand we actually did something. Basically, it is, okay, we try to say physical performance. For example, grip strength, which is y sub ijk. It's a function of the individual level education, for example, household level income, and also, community level income. Okay, quickly, in terms of the findings, we find, if we adjust for age and gender, we can find, large disparity between community variabilities. So what does that mean? That, for one example, elderly people in urban communities have significantly greater grip strength, which is a reflection of better health than the rural communities. Okay. However, median income, education, did not seem to be correlated with grip strength. In terms of household income, okay, expenditures and income sufficiency, which did not explain a great deal of variability. However, okay, people who live in the household with higher expenditure sufficiencies and income tend to have greater health and tend to have greater, grip strength. Okay, so that's again, what we find. Then we finally include individual level socioeconomic status. Clearly, in addition to age and gender, okay, higher education was associated with greater grip strength. And then there is some, but also the relationship, okay, there's some variation in the associations between urban and rural, and I'm not going to get into that. If you wish, we can talk about that later. So that the previous 3 slides basically cover the results based upon grip strength. We also did a parallel analysis with regard to gait speed. Okay, how fast you walk is what geriatrician will call the vital signs of your health. Needless to say, if you walk faster, you're in better shape and better health. And we actually find, okay, gait speed is also correlated with socioeconomic status at the individual household and the community level. And there's also some interaction effect, meaning, such association would be different between urban and rural. For example, in rural areas, we find, okay, monthly consumption, higher monthly consumption means people would positively, would be negatively, would be positively correlated with the gait speed, okay? And in urban area, it did not make a difference. So what does it mean? Okay, let me kind of quickly try to reach the conclusion. We know, okay, in addition to the individual socioeconomic status, our findings have shown it's not just your individual attribute, but also your household, your community attributes in terms of socioeconomic status would have a distinct, significant impact on your health as measured by grip strength and walking speed. And we had, other investigators who actually made observations of socioeconomic status and health in China, okay? And they have found something similar, except, as I indicated previously, they all rely upon different measures. So we actually felt in this particular research is kind of relatively unique in a sense. So we have this measured performance-based measures, which hopefully would provide another more rigorous test of the thesis of the linkages between socioeconomic status at the individual household and community level as having a significant impact on individual health. So we needed to, so I thought, I'm in public health, so every time I write a paper in all these esoteric analysis, I'm always responsible to explain what difference does it make, so what? So here I'm going to essentially indicate, first of all, we have shown, okay, in the case of China, okay, probably the most important thing is the very profound differences between urban and rural in terms of, individual health in terms of health of the middle age and the older adults. And we are actually being able to demonstrate that, with, these performance-based measures. In terms of public health, I think, when we talk about health promotion and disease prevention, oftentimes, particularly in this country, it's focused on intervention at the individual level. For example, we will try to inform people better about nutrition, the benefit of not smoking, try not to abuse alcohol, the advantages of exercise, nutrition, so on and so forth. All these are well and good, but we need to also worry about what we call the upstream determinant. We need to worry about the social structural determinants of population health. Okay, we need to worry about the income distribution, education, human capital, as well as the distribution of resources across different regions. So this is basically yet another study which shows, okay, we needed to really, so therefore, okay, when we talk about public health, we should not just focus on what we often would characterize as health policies. My contention is all public policies would have health consequences. When we talk about tax policies, when we talk about employment policies, they all have health consequences, and we need to be very conscious of that. So these are the type of things I thought we would do, and clearly we're just barely scratching the surface of this. And also it's kind of interesting when we talk about income inequality. Even though most people would recognize high income inequality is harmful for population health, we need to know more about whether there is a threshold of income equality, okay? Because, the capitalist economic system is more or less built upon people not being paid, the same amount, because to reflect individual initiative, effort, so on and so forth. But on the other hand, if it's becoming too excessive, it's going to have some harmful effect. So this is a very critical issue. I think this is all I have. And if you have questions, I'd be happy to entertain.